Hi, welcome to C-Suite Talks. We speak with industry leaders, introducing you to some of the most interesting people and businesses today. We are focused on women, money, and power, as well as diversity in all areas. I'm Dianne Gubin, co-CEO of C-Suite, along with...
I'm Beth Hilbing, co-CEO of C-Suite, and we're so pleased today to have Dr. Sanjay, I'm going to say your last name for me.
Bhojraj.
Bhojraj. Okay,
Just
thank
Dr.
you.
Sanjay is fine. Don't worry.
Dr.
That's what I'm
Sanjay.
called.
Okay, board-certified cardiologist, functional medicine advocate, and founder of Well12. And so we're going to dive into all that today. Dr. Sanjay is a leader in cardiovascular health, merging interventional cardiology with precision and functional medicine. As one of the few cardiologists certified in functional medicine through the Cleveland Clinic, affiliated Institute of Functional Medicine, he reimages heart health by addressing root cause of disease, which is so critical. So thank you to our listeners and welcome Dr. Sanjay to C-Suite Talks.
Thank you for having me, guys. It's awesome to be here.
Yay. So thank you, Dr. Sanjay, for coming on. Gosh, I have so many questions for you. Well, we both do, right? So first of all, let me ask you, your approach to heart health is very unique because you combine interventional cardiology, which I would imagine is going into your body, right, with functional medicine. So you've got these two disciplines going, and how do they work together, and how is it integrative, and why is it important for our long-term health?
Right. So thank you. Again, great question. So interventional cardiology, for what that is, I'm the heart procedure guy, right? So I was the one, if you have, chest pain at 2 a.m, rushing in, going through your wrist or the arteries in your leg and putting in those little devices, those springs called stents. Hopefully none of your listeners have one of those, but probably, unfortunately, this being what it is, someone's got one somewhere. And then kind of went into what are called structural heart interventions. So we're able to avoid open heart surgery and do a lot of things like putting in new heart valves and things, all much more elegantly through the arteries than open surgical. And I think as part of that, you just have a very fix it mindset, right? Like where you're just, all right, what can I do? What's within the realm of possibility to get this better, right? To fix this. And so it's kind of a tinkering mindset. And what I realized as I practiced was, why am I getting repeat business, right? Like something is going on, right? Like we always talk about like customer lifetime value and repeat orders and all that stuff. But in my line of work, you should never have repeat business because that means someone's having a second heart attack, right? Or a second bypass surgery. What the actual heck is going on? And I realized that what we were not focusing on in cardiology is, I think, what are the more important aspects of health is diet, lifestyle, mental, emotional, spiritual aspects of things. Because, with medicines, I can push a number up or down or left or right, or I can do whatever I want to do. But controlling a number isn't really taking care of the underlying issues, right? So like if your house is on fire, putting a new piece of artwork is not helping anything, right? And I kind of felt like that's what we're doing, is that we were focusing on the wrong things in conventional health. And so that led me into functional medicine, and it actually blends quite well because it's still fixing things, just in a much more meaningful and kind of underlying fashion.
Well, that's fabulous. So with your expertise in cardiac imaging and what is omomics, so you have to tell me, technologies, how do these tools help for more precise diagnostics? And so
Yeah.
what is
what is
omics?
Omics. Yeah.
Okay.
In my world. Yeah.
It's a mouthful.
So when medicine first started, right, what did we do? We observed people. We looked at different things. There were so many, skin manifestations of disease and all these different things. And then, that led into physical examination and the stethoscope, and now actually being able to listen to things. And then that led to surgical interventions with the advent of anesthesia and being able to actually do surgeries on folks. And then we got into imaging, right? X-rays, CT scans, and X-ray is a science really just from the 1890s. I mean, we're not talking about thousands of years; it's hundreds of years, right? And so, with each stage, we're getting kind of further and further and better insight into what's going on in humans. And so now, in the world of precision medicine, and I, I'm happy to say that I serve as the director of cardiovascular precision medicine for the American Board of Precision Medicine. But what we're able to do now is use molecular diagnostics to actually see what's happening in you as an individual. So, for instance, if there's a listener out there who happens to have a twin, right? Let's say they're twins, and just like that Arnold Schwarzenegger or Danny DeVito movie, one grows up on a tropical fancy island, and the other what grows up in the inner city, right? Well, their genes should be the same, right? Theoretically, if they're identical twins, right? But their exposures are going to be different, right? Like one person like slept, 8 hours a day and was woken up by bluebirds singing fancy songs, and the other one, woke up, had fractionated sleep and woke up from the ambulances going by, whatever, right? Obviously, a fictitious situation, but what happens and what we haven't realized in medicine is that these different exposures, these different lifestyles, all these things will turn genes on and off, and we're learning that through the science of something called epigenetics. So the idea of omics here is that we're looking at these more molecular diagnostics. The first of which was something called genomics or genomics, right? So if you've heard of like 23andMe and Ancestry.com, you swab your cheek, you send it in and they tell you all these things that you have and all that stuff. That's looking at your genes, right? Which is great. It's an amazing advance. Initially, the Human Genome Project took like 12 or 15 years to sequence that. Now you can sequence the human genome in like 2 to 4 weeks, right? So amazing diagnostics have happened there, right? With the computing power and NVIDIA chips and all this stuff. But now we're going beyond that is not only, what are the letters on the page, but what are the words, right, that these letters are making? What are the meaning of these words that are coming out? So from these genes, which genes are working, which genes aren't, which proteins are they creating, and what we're able to do in the world of precision medicine and omics is actually say, hey, you know what? I'm seeing this marker that says within the next 5 years, you're going to have diabetes. Or I'm seeing this marker within the next 10 years that you're at a higher risk of stroke, right? And what do? Well, that's when we get aggressive with diet and lifestyle interventions to turn those genes down or kind of turn down the volume knob on those and promote the healthy genes. So, it's a remarkable time with these molecular diagnostics that we have, but the answers are always kind of the same. We always go back to these I call it grandma medicine, right? My grandma, she's Indian, grew up in a village, right? All the stuff she said: eat vegetables, right? Sleep, go outside and play, right? Be in the sun, right? Like all these, and then eat turmeric. That's all these,
No,
all these
mine was
things that,
eat chicken soup.
yeah, something, but all these like very kind of like what's old is new, right? It's like keeping bell bottoms in your closet so long that they're back in style. Is that all these interventions that are so old but based on ancient wisdom? Now the amazing thing is we're filling in the science behind these, right? And there actually was wisdom. Like it doesn't just happen, right? There are actually, there's actually metabolic and cellular responses to these things that grandma suggested that are amazing.
Awesome.
Yeah, no, that's awesome.
Yeah. So I've got a question. So you've got this amazing background. And so now you've decided that you're going to launch a business that's around wellness. It's called the Well12 program, and it focuses on lifestyle changes over a 12-week period. So can you walk us through what Well12 is and how does it work and what are the transformations and how is it different from maybe conventional programs like you used to do?
Yeah, so it started because I was actually super unhealthy. So this was in the throes of COVID, which was a super stressful time, and I was like, I should probably see a doctor. I haven't seen one. Like socially, we see each other in the doctor's office or in the doctor's lounge or whatever, but I hadn't actually seen my own doctor forever. So I went and got my lab work checked, and it was like a hot mess. All the genetic things that I feared would hit in one day. And so my doctor was like, "Well, Sanjay, looking at your labs, your cholesterol is super high, you're insulin resistant, you probably got sleep apnea, your blood pressure is a disaster, your cholesterol sucks. So let's get you on these 4 medicines, and I'm gonna send you for a sleep study so you can get a CPAP machine." And I was just kind of floored, and I was like, boy, the first recommendation in any guideline for most guidelines, I should say, for most diseases is 3 to 6 months of lifestyle and diet interventions. That's what's supposed to happen. The problem is nobody really knows, as a physician, no doctors really know what that means. So we give you kind of generic things like, well, eat better. What does that mean? There's a, go follow this website or whatever, sleep more. Well, how much sleep should I get? Oh, I'm not really sure. So basically what I've done is through my functional medicine training, kind of created what needs to happen in those 3 to 6 months for you to really kind of put tire chains on the tires. We just, in California, we rarely get snow, so we have to put chains on our tires, but to really get that traction to make an improvement. And kind of one of the things I say is, boy, your doctor will not recognize you in 3 months if you go back. So what is the plan? Based on kind of 3 important aspects, which I think that a lot of conventional programs probably just focus on one, which is diet. And anybody who's done, diets know that, yeah, they work for a while, then they yo-yo back and forth. And I tried this and I tried that, and nothing works for me. That's what you're left with, right? Well, it's not that nothing works for you. They worked when they were supposed to. They just weren't lasting, right? And they didn't address all the things, right? So my kind of three focus, I've got four really, and I'll go through them. But one is obviously diet. So we focus on what's called an anti-inflammatory cardiometabolic diet. A lot of words, but what does that mean? Food actually incites inflammation. Inflammation is your body's response to biological fear. So if your body's always in this fight or flight, running from a monster kind of phase, it's not going to work out very well, right? That leads to stress, right? And with stress, your audience, I don't have to tell them what stress is, right? Because you've got deadlines, you've got emails, you've got that one coworker you just hope doesn't call you, right? Like, oh man, you see their name on your phone, you're like, oh my God, I'm going to have to deal with this person. And then sleep is so central to what we need to do. Sleep, actually, while you're sleeping, you're increasing something called brain-derived neurotrophic factor, or BDNF. That's kind of like what makes your brain grow and code memories and all that stuff. If you don't have adequate sleep, your brain is just not going to work right. So I focus on diet, stress, and sleep in the program. And then the fourth one that we add in is eventually movement, exercise. But you don't have to run a marathon. You just have to get out and walk. But those four things, if you were just optimizing those four things, in my experience, I've seen 90% of people get better. And then, with that 10% that still needs focus, then we can kind of send the Navy SEAL team in and focus on whatever issue they're having, because some people are complex. But it's remarkable, like what I've seen: thyroid issues improving, perimenopause and postmenopause symptoms getting better, hypertension, like my blood pressure dropped 20 points, from 140 down to 120 with just diet and lifestyle interventions. Lipid improvement. I've had, and obviously I can't speak for everybody, I can't make these promises, but I've had people in the program who had been on insulin for like 15 or 20 years for the diabetes stop insulin because their sugars were now controlled, because we're optimizing their biochemistry and their cell function. And, this isn't through meds. This is just broccoli, guys, asparagus, like learning kind of the right things to eat, right? It's like the cheapest medicine you've ever had, and what I love
Don't
about
tell
it too.
George Bush that.
Broccoli.
Yeah.
Definitely don't ask him to spell it, but was
Yeah,
it tomatoes?
exactly.
That was Dan Quayle and tomatoes. I can't
Dan
remember
Quayle
now.
was potatoes.
Potatoes, yeah. But the point being is what I love about this. Number one is it returns agency back to the patient, right? Because as you're doing the program, you're seeing your health improve and you're taking that on, right? How many of you out there are listening have a contract that you just sent to your lawyer without looking at it yourself, right? There's things that are going to be missed because nobody advocates for you better than you, right? So if you can take back that agency, that control of your health, what a foundational, fundamental thing that is. And I think too many people just outsource it to a healthcare system that's not taking care of people, right?
Yeah.
So getting people off of meds for insulin is remarkable. Seeing the balance in perimenopause, that's something that has been remarkable for me to see, because inflammation and all these things drive so much of these symptoms that women suffer, right? We were talking about this, I think, before. Like, women are complicated, and it's not just in the life cycle. You're prepubertal, then you've got your menstrual, your puberty, you've got childbearing age, perimenopause, premenopause, like all these different cycles. And while it sounds complex, and it is hormonally very complex, it's the same underlying things that can optimize health.
So
Brain fog.
Well12 is at any time. Is it only for women, and is it any time in
It's
your life, or do you have to be a
men,
certain
women.
age?
No, anytime. I've actually had my youngest client was 21 years old, and it was actually one of the nurses that I used to work with bought it for her daughter because she had had such an improvement in her health. And her daughter ended up having a lot of anxiety and depression issues and stuff. And we don't in the conventional world, we don't often talk about how the foods that you eat and the balance of the good and the bad bacteria in your gut, called your microbiome, affect mood. I mean, think about when you eat like a big, heavy meal, you just kind of feel gross. But if you do that every single day, you're going to get brain changes and biochemical changes that happen. So 20s is the youngest, and probably my oldest, I think, was 86. It's never too late to optimize your health. And that was someone who actually had a lot of concerns with cognitive function. She was about to start a clinical trial for Alzheimer's meds, and her daughter kind of heard of me through the grapevine and asked, is there something that can help? said, yeah, there's probably some neuroinflammation or something going on. Let's check it out. And this was a woman who was like forgetting to wear pants going outside and whatnot. And just within the first 4 to 6 weeks of starting the program, she was now writing letters in her proper penmanship, was remembering names, all these things, sleep, diet, stress. I mean, it's such simple things, but yeah, any stage of life.
Oh,
It's
thank
fabulous.
you for that.
So you're a clinical educator at the Institute of Functional Medicine. You train other practitioners to integrate functional medicine principles. What are the important lessons you aim to impart on your fellow practitioners?
Yeah, no, it's a great question. So yeah, thankfully, or through the happenstances of the world, right? I've been asked to be an educator for them, and I think the first and most important thing, such an easy thing for caregivers or healthcare providers to give that we often overlook, is listening first. Right? How many times have you been to the doctor and within the first, I mean, there's statistics on this. It's like within the first 7 seconds, patients are being interrupted, right? And on the first day of med school, they say, the patients always have the answer. You just have to know how to decipher what they have to say. So, number one is listen to your patients. People have better things to do than to show up to the doctor, right? And I was just on a call with a potential client yesterday, and she said, I've been to like 5 or 6 doctors. She was actually one of my patients in my previous practice, and she sought me out. She tried to find me, and she said, Dr. B, you're the only person that I never felt rushed in a visit with, and you listen to people. And I think it's such a fundamental human need to be listened to, right? But as a healthcare, as a doctor, like, it's such an important thing because you can pick up on so many nuances. So before I've even talked about science, the first thing I tell people is to listen, right? And
That's
then
great.
number two, don't discount kind of where a patient is at, right? I think too many times when we think about diet and lifestyle and any intervention, really, we're like, oh, just take this pill 8 times a day. What, like, how are you gonna do that, right? Like,
Yeah.
meet people where they're at, right? Meet people where they're at,
Yeah.
and figure out what
Sanjay,
interventions are
we
going to
need,
work.
Dr. Sanjay, we need one for pets too. It's not just people,
Yeah,
because our
I mean,
pets end up taking a lot of meds too if they get sick.
well, and they're, and we can talk about pets in a moment. Let me just get to number 3
Yeah.
here.
No, we
So,
don't have
oh
to.
man, lost my train of thought. So number 1 was listen to patients. Number 2 was meet them where they're at. And I had such a great number 3. I can't remember, but let's talk about pets for a moment, right? Because pet longevity, I am also getting certified in longevity medicine. Pet longevity comes up. And if you look at you go to whatever pet food store you have, and there are 1,000 pet foods, right? And there's an anti-inflammatory, there's a this, there's a that. Well, why? Because we've gone from feeding pets foods that their bodies were used to feeding them ultra processed foods in a pellet form, right? I've never been out in a forest and found a big mound of pellets. That does not exist in nature, right? So what we're seeing with our pets now is they're getting a higher incidence of like diabetes and seizures and all these things because they're eating ultra processed foods. Kind of what we call the SAD diet, or the standard American diet, is the same thing. So we go to all these great lengths to find our dog and I have a dog, so our pet's the right food, and we'll spend all this extra money, but when it comes to our stuff, we don't have that same level of care, right? We're like, oh, I'll just hit the fast food joint. Who cares? No big deal. But
I'll eat the spam.
yeah, I mean, whatever. I don't like to name products because I don't want
I know exactly.
I don't want someone to come out and cancel me because I don't like potato chips or something. But we have to pay attention, and cravings. I think when we have cravings for certain foods, that's like a cry for help from our cells, right? From our body saying, I need something. I can't make you, I can't make you eat, this food, but I really, really suggest through the hormones that I'm spitting out that you do this. And oftentimes, because we're not eating the right foods, the only distress call that our body has is for high calorie, high dense foods like ice cream and chips and kind of all these things. But if you're giving the body what it needs, like, cravings go away, right? There's something called phytochemicals. So these are the chemicals that exist inside vegetables. And there's a phytochemical that actually works as a GLP-1. Everyone knows all this GLP from all these Ozempics and things, but works as a GLP modulator to help reduce cravings, because now when you're eating these green leafy vegetables, you're giving your body what it needs. So biochemically, it's designed to help your body feel more satiated. I mean, the more you learn about the body and how it works and interacts with the world, like, it is just amazing how many things are happening at once, and it seems so irresponsible to not give your body what it needs, right? I mean,
my
it's just
God.
it's
Dr.
crazy.
Sanjay, you are amazing. So let me ask you, we need to wrap in a moment or two. Where does somebody find you, and what's your website for Wellness 12?
Yeah, so you can find me on Instagram, Facebook. It's Dr. Sanjay MD, so DOCTOR SANJAY MD. On all the socials, and there I do a lot of free content and top tips, and I'm just got blasted. Somebody thinks I'm anti seed oil, which I'm not, but it's the internet is an interesting place. And for those of you who want to consider Well12, you can go to my website www.lagunalongevity.com. I'm sure we'll have it in the show notes. But really the focus that I have in this phase of my career is making humans live as long as we can, right? But living well. And while most people think of that as medicines, it doesn't need to be. Like I've had patients in their 90s who are on zero meds because they're doing the diet, the lifestyle, they're staying connected in the community, they're doing all the things. And it's all stuff we know, right? Our grandmas told us this, right? For goodness sake, it's just hard to deploy, right? And so anybody can be successful if they're self-disciplined, but for those people, great. But for the rest of us, we need structure, we need a coach, we need somebody to push us and to give us the information easily digestible. And that's what Well12 is. It's been so remarkable. Of all the lives that I've saved in interventional cardiology and stuff, the ones that I'm the most proud of are really, I think of this couple. So this young couple in their 30s did the program. The husband and wife did it together, and they were telling me now that their two daughters were eating healthy now because they were modeling after their parents, right? So think about that now, right? Is that next generation is learning how to eat healthy, so they're not going to have to suffer the things that we're suffering. Like currently 93% of Americans are metabolically unhealthy. That's our diet, that's our lifestyle, that's all these things. But my daughters are doing so much better with their eating because they see how my wife and I eat now, right? So it's really bringing up that next generation that is so important and so impactful, and it just the compounding interest on this grows so fast that my ultimate goal, and it sounds crazy, is to increase the life expectancy of humans in America or across any geographic line by at least a year. And although that doesn't sound like a lot, it takes a ton to move that needle a year. And that's really what I'm trying to do with this program.
Let's do it.
So appreciate you so much. So we'll thank our sponsors: Co-Resnick Advisory Tax Services, City National Bank, Cigna, Uncle Nearest, and C-Suite Executive Search. Hiring for a team? Call us. And then Dianne,
yes, well, thank you, Dr. Sanjay. We love getting to know you and all the work you're doing. Thank you, Beth, and thank you to our listeners. So what are we going to do? We're going to hit the subscribe button, Apple, Spotify, anywhere you find your podcast. Be sure to give us a like, too. We always appreciate a review, a good one, please. And, of course, follow us on social media, LinkedIn, Twitter, Instagram. And we love hearing from you. Beth loves emails. Sorry, Beth. But Beth at C-Suite, that's C as in cat, C-Suite like in sugar, SWEET.org. And of course, our website is www.CSweet.org. And again, thank you for listening today.
Thank you, Dr. Sanjay.
Thanks, guys, for having me. It's been so great.